Hello, it's Dr. Rhonda Johnson. Today is Wednesday, March 13th, 2024. Did you know that March is Developmental Disabilities Awareness Month? Well, now you do. But first, let me tell you about developmental disabilities. They're a group of health conditions that can impact communication, mobility, learning, and behavior. Now, these problems usually start when a person is very young, and they can last an entire lifetime. Now, you might have heard of some of these developmental disabilities. Common examples are autism, cerebral palsy, or Down syndrome, but there are others too, like ADHD, just to name a few. So a lot of times these disabilities are diagnosed because a child falls behind in the milestones that are expected for their age. This is called a developmental delay. Now, there can be many reasons for developmental delay, including genetic factors, environmental factors such as, for example, lead poisoning in childhood, underlying medical conditions, for example, meningitis during infancy, or pregnancy-related conditions such as infection during the birth canal period, low birth weight, prematurity, or prenatal exposure to drugs and alcohol, unfortunately. Now, developmental disabilities can also result from early trauma to the brain. So talking about these developmental disabilities isn't easy, folks, because there is just too much to say and too little time on a short video. But it's important to know that there are lots of ways to help people with developmental disabilities. Interventions like classes tailored to their needs, or therapy such as speech therapy and therapy for movement, nutritional therapy, and there's even medication or surgery that can make a difference in the outcome. Nowadays, the life expectancy of most people with developmental disabilities approaches that of the general population. With appropriate medical care, accommodations, decision-making support, adult persons with developmental disabilities can live quality lives, often in their own homes and in their communities. So individuals and families of persons with developmental disabilities, it's important that they have their needs met for, let's say, information about resources available to them, adaptive equipment or aids, environmental adaptations, personal assistance, accessible transportation, and accessible environments. You know, every person, regardless of their abilities, has the right to be respected, the right to be embraced and provided with opportunities to thrive. I certainly support opportunities for individuals with developmental disabilities that allows full access to education, housing, employment, and recreational activities, just to name a few. So that is my message today. I hope that you will be well, and I hope that you take care.